Good afternoon. Welcome to our fall prevention presentation. My name is Amanda Bruner. I'm the wellness coordinator and personal trainer here at Westminster.
And I'm Allison Johnson. I'm the therapy director here at Westminster.
Okay, so let's get started.
All right, here we go.
Okay, so overview of what we are going to talk about today. Fall risk checklist, understanding falls, environmental factors, individual factors, balance, preventing falls, and intervention. So if you'd like, you can grab a piece of paper and a pen and just kind of go through, as we go through these questions, write down yes or no. So the first question is, have you fallen before or been injured because of a fall? Yes or no? Do you feel weaker than you used to, or do you have less strength in your arms and legs? Yes or no? Have you stopped doing daily activities or avoided exercise because you're afraid of falling? Yes or no? Do you experience incontinence? Yes or no? Has your hand strength decreased? Yes or no? Has your eyesight diminished, or do you have trouble seeing depth or seeing at night? Yes or no? Have you experienced hearing loss? Yes or no? Do you have foot ulcers, bunions, hammer toes, or calluses that hurt or cause you to adjust your steps? Yes or no? Do you feel unsteady or your feet or on your feet or shuffle when you walk? Yes or no? So if you answered yes to one or more of the previously asked questions, you could be at risk for a fall. Understanding falls. In 2014, the population of people aged 65 and older numbered 46.2 million. By 2030, the number of U.S. adults aged 65 or older will be more than double, about 71 million. The age group 85 and older is now the fastest growing segment of the U.S. population. Understanding falls. 1 out of 3 older adults falls each year, but less than half tell their doctor. Falling once doubles your chance of falling again. And each year, 2.5 million older adults are treated in emergency rooms for fall injuries. 1 out of 5 falls causes a serious injury, such as broken bones or a head injury. Over 700,000 patients a year are hospitalized because of a fall injury, mostly because of a head injury or a hip fracture. Understanding falls. Fear of falling can lead to a spiraling immobility. So, what causes falls?
Oh, things my left. 6 feet, 6 feet. All right, so the first thing that we have to look at is environmental factors. So this could be things such as poor footwear, clutter where you walk, poor lighting, inadequate walking devices, unsafe steps or walking surfaces, movable objects on wheels, unfamiliar settings, or lack of railings and grab bars. There are also some individual factors. So looking at this, so we can look at the medications. Some types of medications can cause you to be at greater risk of falls. So that can be narcotics and non-narcotic analgesics, there it is, insomnia medications, anti-anxiety medications, antipsychotic medications, heart medications, muscle relaxants, and antihistamines. So more than likely, we're all taking one of these. I know I am. So other individual factors could be poor vision, decreased strength in your trunk and legs, decreased flexibility in your neck, spine, and legs, pain, cognitive and or memory issues, gait disturbances, or other medical conditions such as heart, lung, circulation, nervous system, and incontinence. Also, balance. Now, all of these individual factors can be addressed through therapeutic intervention. So here at Westminster, we offer physical therapy, occupational therapy, and speech therapy. So using the entire interdisciplinary team, we can help decrease some of these risks. So let's talk about balance. I love that cute little elephant. Okay, so your eyes are what tell you about your environment. And the vestibular system, which is located in your ears, gives you information about your environment, your location, your speed, direction, and your movement within your environment. So these two things are very, very important. Now your trunk, meaning your core, your tummy muscles, your back muscles, those are the foundation of your posture, balance, and coordinated movements. So your trunk can be trained through therapeutic intervention and also working with Amanda, our wellness coordinator. And we can help increase that stable foundation, increase that movement ability. So why would your balance be impaired? Things such as poor posture, slumping or rounding of the shoulders, how far apart you keep your feet. Sometimes we forget that we need a wide base of support. We start to narrow that base of support, and that increases our risk of toddling over, if you will. Diseases such as diabetes, they can lead to neuropathy, and inability to know where your feet are and where your feet are going. Now, your strength, this is something that over time, as we get older, we move around a little bit, we move around less, and then we start to experience some decreased strength, flexibility, and endurance. So, what if your balance is impaired? So you can do exercise programs such as Tai Chi or balance programs. Be sure to remain active, but keep the potential hazards in mind, and you can consult your therapy team. So, the fact of the matter is falls can happen. I tripped up the stairs on my way over here, so they happen to us all. Doing everything you can to prevent falls can help you live a more independent life. So, we've talked about what can cause falls. We've talked about all of the components that go into that. So now let's talk about what we can do to prevent them. So, first things first, take care of yourself. If you're weak, if you're dizzy, don't get up and try and walk. Let's make sure that we address those issues. And make sure that you check your vision and your hearing regularly. And know your medications. Know how the medications interact with each other. And consult your doctor if you feel that your medications are interacting and decreasing your ability to stay on your feet. So let's make sure that we have shoes that fit properly. We don't want any movement in there. And make sure that you exercise regularly. So take care of yourself while you're grooming. So we can install grab bars, install non-skid mats, we can use some shower chairs and bathing benches, and we can use long-handled brush or mittens with straps. So all of these things, if you have any questions, comments, concerns regarding implementation of these devices, feel free to contact the therapy department. Our occupational therapist is highly skilled in understanding what is appropriate for each individual patient. So take care of your home. Watch your doorways, throw rugs and clutter. Repair loose carpet. If you have any concerns with that, you can always contact your maintenance department. Rearrange your furniture to make sure that you have the ability to use your walker in all spaces of your home. Wipe up any spills as soon as they happen. Don't put it off till later because we might forget. So check your tennis balls or the rubber tips on your walkers regularly. If you need more of those, we can order those for you. And keep your house well lit. Good lighting is the key to success. Store your items that you use frequently on a low shelf so that way you can access them easily and decrease that risk. And wearing proper shoes, as we've discussed before. So if you would like, you can go to the CDC website and check for safety home fall prevention checklist, and you can ensure that your home is safe. If you don't feel confident in doing that independently, you can always reach out to Amanda or myself, and we can help you with that. So take care of yourself while you're outside. Use a cane or a walker whenever, as you need it. Walk on the grass when the sidewalks are slippery, and use caution when there is inclement weather. Make sure you bring your call button with you, so that way if you do fall outside, you're able to get help as quickly as possible. Now, are you at risk for a fall? Several therapy screens are available. There's a time to get up and go, the functional reach test, the TNEDI, and the Berg. These are all tests that our physical therapists, occupational therapists use to assess and diagnose difficulties and figure out the best plan of care to decrease your risk for falls. So for more information on whether you might or might not be appropriate for therapeutic intervention or at risk for a fall, consult your therapy team. So therapy can help by completing comprehensive evaluations through physical therapy, occupational therapy, and speech therapy. Sometimes people are at more risk for a fall due to a cognitive decline or a difficulty with sequencing and motor planning versus just a physical demobility. So we work together, all three therapeutic disciplines, to establish the most appropriate plan of care for you. So we're going to partner. We always partner with the individual, the family, the physician, the wellness coordinator, everybody. We talk to everybody. So if you think that you need skilled intervention, a therapy referral from your physician is required. Now, how can therapy help with the low vision? We can help modify your room. We can help set up your environment for success with that vision deficit. We can work on your balance, your coordination, as well as help to manage your pain. So if it's a musculoskeletal pain, we can address that. If it's more of a medical type pain, we can always reach out to your medical provider and help manage that appropriately. So we can help you through occupational therapy, adapt your activities of daily living. That would be installing the grab bars, the benches in the shower, things like that to help you be successful in your home. We can work on some education regarding the best way to do things, how to stand, how to increase your core strength. We can work on that flexibility, as I've already discussed, the strength, and the environmental modifications. We can assess you for potential walking devices. We want to always use the least restrictive walking device. And we can also help with incontinence. So Amanda, you want to take it from here? There you are.
Alright, so how does fear of falling affect you? It may stop you from participating in activities and exercise. Inactivity will lead to weakening of the legs, which is imperative in maintaining balance. Inactivity and weakening of the legs will make a fall more likely. So how can wellness help? So we have a senior fit test that we do. We also offer a variety of exercise classes, and we have an at-home balance strengthening exercise handout. So let's go through each one. So our senior fit test. So this is an initial fitness assessment performed on residents. It consists of testing your strength for upper and lower body, flexibility for upper and lower body, and then balance, coordination, and also your aerobic endurance. We usually recommend that you take this assessment every 6 to 12 months. Once you have been evaluated, I will make recommendations on how to improve certain areas that need attention and also to help prevent falling. So another thing that we'll discuss is I'll make some recommendations on some classes for you based on your results and how to help you get into an exercise routine. So some of the classes that we have right now, in person, we have them in Harris Bell Hall, of course, but we are doing social distancing. We have to wear a mask, and we are keeping the classes at a max of 10 residents. The other thing is you will have to sign up for the class. If you want to do any of those in-person classes, you need to sign up in the activity book in the Preston lobby. So just a few of the classes that we have in person is a gentle yoga, which I teach, cardio fit, better balance, total body blast, senior strong, and then aqua conditioning, which is in the pool, so in the aqua center. And then some of the classes that we have playing on channel 1890, the in-house channel, is a beginner ballet class. We also have our resident-led chair exercise class. We have gentle exercise with Leah or Brooks. We have a Tai Chi showing. We have better balance with me. That's the one that's on channel 1890 or live. We have Pilates with Cindy, and then we have line dancing with Sonia, and stretching class with Amanda. So we have a variety of classes offered. So for the at-home balance and strengthening exercises, this is a handout that I created and I titled it Stop the Fall. This was something I created a while back for fall prevention. But it's a list of 7 good lower body and balance exercises for you to do in your home, or you can do them in the gym, really anywhere. You can find this handout on the tables in the Preston, Windsor, and Arbor lobby, or in the Preston gym on the ground floor. You can also find an exercise calendar with class descriptions in any of those locations. And so we're going to end with a myth buster. Falls are an inevitable part of getting older. Again, falls are an inevitable part of getting older. Do you think that is a myth or a fact? Well, the truth is, falling is not a normal part of aging. Weakness and poor balance are linked to inactivity rather than age. Our risk of a fall decreases with this one simple thing. What do you think that is? Exercise, exercise, exercise. All right, so if you have any questions, for more information on more exercise or on falls, please contact Amanda Bruner, myself. I'm the wellness coordinator and personal trainer here. You can find me or contact me at 512-454-4711, extension 2295, or email me at amanda@wmanor.com, or find me in the Preston gym. And for more information on falls, please contact Allison Johnson. She's a rehab care program director. You can also call her on the main line, 512-454-4711, extension 2642. Or email her at Allison, that's Allison with a Y, .johnson@rehabcare.com. Thank you so much for joining us for our fall prevention presentation. Have a great day.